Thank you, Andrew. Hi, everyone. I'm so excited. Hi, gang. All right. So, I want you all to close your eyes and imagine yourself as a 22-year-old young woman. You're in a great place in your life, and things are just beginning. You're bouncy and full of energy and collagen, and you're thinking about if you're going to work this summer or travel, or if you're going to go on that date with that really amazing person you just met. You're full of excitement and nervousness and overwhelmed by the possibilities. You have the whole world at your fingertips. Time feels limitless, and you feel invincible. The weight of the world is not yet on your shoulders, and you're free to choose what you want to be and what you want to do with your life, and there's no one and nothing holding you back. Now, imagine yourself as that same 22-year-old, but with a debilitating condition, one that leaves you in pain for days on end each month. But everyone keeps telling you, this is normal girl pain. But that pain never goes away. And all this time, you've been telling anybody who will listen, but no one ever does. You have pain so severe that you've been missing 3 to 4 days of school each month, and so you didn't go to university. You have pain so severe that you can't even keep a job, and you will fall into poverty, and you will never go on that date, because the thought of having sex is excruciating. And because you have this pain, and because you've been dismissed your whole life, you develop anxiety and depression. You don't trust the system. You don't even trust your own body. What you have is endometriosis, but it might take you 10 to 12 years to ever receive this diagnosis. And by then it's too late. Your life has passed you by. My name is Dr. Tania Di Renna, and I'm the mother of 2 young girls, Rosa and Lily. I'm an anesthesiologist and a pelvic pain specialist, and the medical director of the Toronto Academic Pain Medicine Institute, or TAPME, at Women's College Hospital. I'm also the chair of our provincial network of academic pain programs. TAPME is a partnership between 5 academic hospitals across the Greater Toronto Area that work together to provide pain care for patients. And Women's College Hospital acts as the hub for this program. We are currently the biggest pain program in North America with over 7,000 referrals per year. And the story I told you is why I do this job. Because for some of you, you didn't have to imagine this. Because you or someone you love lives this. Women like this are not alone. Women like this make up my entire clinic. Endometriosis is an enigmatic, painful, complex disease that affects approximately 1 million people in Canada. It can involve multiple organ systems, and if left undiagnosed or untreated, it becomes a debilitating chronic pain disorder that affects all facets of life. And yet, it takes women on average 10 to 12 years to receive a diagnosis. And even once diagnosed, it can still manifest into a chronic pain syndrome. In Canada, 70% of chronic pain sufferers are female. That means 5.6 million women in Canada have chronic pain. And it doesn't just mean endometriosis, but includes migraines, lower back pain, and many other chronic pain conditions. We can't let women live like this. This is a public health emergency. And what's even more surprising and infuriating is that 80% of studies in chronic pain are done on males and male animals. So how will that inform better care for my chronic pain patients, for endometriosis, for women in general? We see a lot of discrepancies across the healthcare system in the way females experience pain and pain management. Women are 7 times more likely to be dismissed, misdiagnosed, and discharged in the middle of having a heart attack. And in emergency rooms, women wait longer than men to receive pain-relieving medications. And for women with cardiac issues, if you're lucky enough to be believed that you're having a heart attack and that you have bypass surgery, you're half as likely to be prescribed pain medications as your male counterparts who are having the exact same surgery. So why is this happening? All right, I'm going to take you back and teach you about pain. Pain, by definition, is an unpleasant sensory and emotional experience. So it's 2 factors. It's a sensation and an emotion. And your life experiences determine how you perceive pain. It's associated with your body being damaged or even just the threat of your body being damaged. Pain asks us to watch out. It's good. It tells us to be alert. We want our bodies to give us this information because it allows us to adapt accordingly. We call this acute pain. I like to explain acute pain as a fire alarm bell that goes off when there's a fire on your stove. The alarm bell is like pain. It warns us that there's danger, that your stove has caught fire. It makes us stop and pay attention, take action, and call for help. Chronic pain is pain that keeps going when it shouldn't, meaning it persists longer than 3 months. And we use that 3-month timeline because it takes the body 3 months to fully heal from an inciting incident like surgery or an injury. Chronic pain is a broken fire alarm bell. It goes off even when there's no fire on your stove. And that fire alarm bell can break for any number of reasons. And one of them is not addressing the pain when it's happening in the acute phase. And every time you try to use your stove, that fire alarm bell gets louder. It makes you think that surely there must be something still wrong with my stove. So you seek help from your stove repair person, your family practitioner. And someone examines your stove and tells you you're fine. No fire, nothing showed up on your MRI. They tell you to keep using your stove, but you feel like you can't because that fire alarm bell keeps going off. And now you've stopped cooking, and now everyone in your home is going hungry, and there is no cure, and now you have to try to live with the broken fire alarm bell. And now you don't want to live with a broken fire alarm bell. Chronic pain is a huge misunderstood problem in Canada. It's the face of disability, and it's affecting 20% of our population, and most of them are women. At TAPME, we really try to treat the individual as a whole person and not just an area of pain. And that involves educating people about pain, using psychological interventions to manage anxiety, depression, and sleep disturbances, exercise, movement, medication, and injections to help relieve pain. The basis of pain management is to teach you how to use your stove and love your stove again, because there's no magic bullet yet that we can use to make chronic pain go away. I mentioned chronic pain is one of the biggest problems facing the healthcare system in North America, and at TAPME we receive over 7,000 pain referrals a year, and most of these are women. So why do women experience chronic pain at such alarming rates? Well, there's 2 different mechanisms to explain why women experience more pain than men. Number 1 is the difference in our hormones. Estrogen and progesterone, the 2 main hormones that fluctuate throughout the menstrual cycle, can influence pain perception. In the luteal phase, roughly on day 15 of the menstrual cycle, estrogen levels drop and progesterone reaches a peak. And if you have had or have a menstrual cycle, you may notice that you become more sensitive to pain than what is normal for you. So those fluctuations are pronoceptive, meaning they make you perceive more pain. Testosterone, on the other hand, which is higher in men, is antinociceptive, which is basically just a fancy name for being protective against pain. And we see the evidence for that, or for hormones, playing a big part in chronic pain conditions in the pediatric migraine data, where the incidence of migraine headaches before puberty is the exact same for boys and girls. And then after puberty, once the males have exposure to testosterone, their incidence of migraine headaches significantly decreases, while for girls it triples. The second factor for why women experience more pain is psychosocial mechanisms. In women, we see a lot more of what's called pain catastrophizing and lack of self-efficacy. Catastrophizing is the act of ruminating, magnifying, and then feeling helpless about a situation. And women demonstrate much higher rates of catastrophizing with respect to pain. Well, why do we catastrophize? Because no one listens. The doctor is sending your mother home with a heart attack. And because we catastrophize, our pain perception increases. Women also have lower rates of self-efficacy, and this is defined that the belief that you can successfully perform a behavior and achieve a desirable goal. And that's sad to me. This may not come as a surprise to you, but from birth, society treats women a lot differently than they treat men. We're expected to do more, but celebrated less, expected to be smarter and kinder and more patient, and yet we're criticized and judged and measured much harder. We also experience pain much earlier in our lifespans than men. Our menstrual cycle is a prime example of this. We're good at feeling pain. Women are also known to experience more adverse childhood experiences. We're exposed to things like physical abuse, sexual abuse, and neglect at much higher rates. And one of the most common symptoms of surviving abuse is the increase in likelihood of developing a chronic disease like chronic pain. So what do we do about this? Well, there's hope. Managing chronic pain takes a team. It takes innovation, compassion, and learning. And this is why I'm so proud that TAPME sits at Women's College Hospital, because we approach pain management in ways that no other place in the world is. We're so innovative in both pain prevention and management. Our team offers state-of-the-art interventional therapies like nerve blocks and radiofrequency ablation and neurostimulation, but we also offer patient education, physiotherapy, psychological interventions, so that we can treat each patient as a whole person and not just a condition. We're constantly adapting to ensure we're a proper reflection of our patients. When we realize that 70% of our patients are females and 80% of our providers were male, we hired more women. The heart and soul of this program are sitting at table 22 and 23 and 11 and 1. And they're not doctors. They're OTs, they're social workers, they're psychologists, physios, or nurses, administrative people. All right, our female staff has doubled in the last 5 years, and we do a lot of female-geared programming, like our pelvic pain program, where we see women with pelvic pain from across the province. We do a lot of female-geared research. Our researchers, Brittany and Rachel, are here to ensure that our healthcare system can catch up and provide the information needed to properly diagnose and help our patients. I want you to think back to that young woman I made you imagine at the beginning. She's real, and she came to us at TAPME. Her name is Magdalena. Women's College Hospital gave her a place to go for help, and she writes to us about her experience. My journey with chronic pain has been very lonely and difficult for the past 5 years. I've always tried to stay strong and keep working professionally while dealing with ongoing pain. Initially, some of my doctors and family members suggested that the pain was possibly in my head, as they could not find a specific cause. I tried just to power through my pain and ignore it as much as I could. I was finally referred to TAPME, where I found myself feeling cared for and not so alone after all. Women's College Hospital changed the course of Magdalena's life completely, so she didn't have to stop living. We can't keep normalizing pain in women. Being born female does not mean that you should be in pain and that you should suffer more than anyone else. We have to invest in the research and care that caters to us. We have to do this for Margaret, for Magdalena, for my girls, for our girls, and for all of us. Thank you.